Over the last 5 years, 47 community practices have started referring all of their patients elsewhere for treatment. 241 oncology office locations have closed, and 392 oncology groups have entered into an employment or professional services agreement with a hospital. That's a fairly staggering shift in 5 years. I think just the fact that we've pointed out the significant cost to patients, number one, not only in just dollars, but the anxiety that comes with getting in that car and driving a greater distance just to have access to care, means that we ought to do something about this yesterday.
I'm very concerned about the cost issue with chemotherapy drugs, especially since the sequester went into effect. We have seen a number of cancer clinics that are in our communities basically closing their doors or being bought up by hospitals.
If you have a 340B hospital oncology-based program, that the delta between what they're charging and paying is such that it creates a competitive advantage relative to community oncologic services.
But it makes no sense if you're going to apply an across-the-board reduction with the sequester of 2%. You would never begin with the ASP part of that equation. The ASP part of that equation is a fixed cost.
And Mr. Chairman, I think we would all be remiss in our duties if we stand by and allow one more cancer patient not to be able to make travel, select not to get treatment, or their costs go up so prohibitively they can't continue treatment. Shame on all of us if we can't pull this together pretty soon so that we don't lose any more of these centers. I think it's awful important we deal with this issue soon.